white feathers turning to green, different things like that can be a sign of illness as well. Runny droppings or extra urine in the droppings and things like that. Closed eyes and drooping wings, so signs that they're getting weak. Not being able to perch, and tail bobbing when they breathe. So normally a bird's tail won't move much when it breathes. If you start noticing that tail really going up and down, that can be a sign that they're really trying to get a breath and that they're not breathing normally. The main thing to know with birds is that once they start showing signs of illness, they're very sick, because in the wild, if there's predators all around and they show signs they're a sick bird, they're going to be picked off first. So they've got what we call a masking phenomenon. They mask it basically, where they don't show signs of illness until they're very, very ill. So that's just something, if your bird looks sick, get it to a vet, because it probably is quite unwell. So when is it an emergency, as in you notice it's 7 o'clock at night and you should call the after-hours vet? Open mouth breathing is a sign that your birds are really, really struggling to get air. So if you see a bird sitting there kind of panting, that's a sign they're quite sick. Sitting on the bottom of the cage is another sign that they're so weak that they can't hold themselves up normally. Any bleeding that you can't stop, obviously, is an emergency. Falling asleep when stimulated. So if you've got a bird that seems a bit unwell and you get them out of the cage and they fall asleep very quickly, even when you're handling them, that's a sign they're quite weak as well. Seizures is important. Birds that are refusing to eat and that you can't feed are important as well. And any bird, like I said, that looks sick should be treated as fairly urgent. So maybe not, 2 a.m. phone call, but definitely keeping a very close eye on that bird and getting them to a vet the next day. So crop feeding, the do's and don'ts. So when crop feeding a bird, the biggest thing is restraint, because if you don't have the bird properly, that's where injuries occur. Because the bird's moving around and things, that's when the crop needle can cause injuries to the crop and other organs. Small birds, the easiest way to restrain them is with one hand. I like to do it where I have the bird's head in between my fingers and then these fingers wrapped around the body. I'll show you a picture in a minute. Larger birds, there's 2 options. One is that you have somebody else restraining them, and this is the bird for you. Some people prefer this, some people don't like it though, because they don't have complete control of the bird, so that you're relying on somebody else. So if the bird's moving, you don't get to feel that movement kind of thing and know that the bird's about to move. The main thing is though, I always want to control the head of the bird. So even in the large bird, if someone else is helping me hold it, if I'm doing the crop feeding, I like to have the head, because you need to be able to feel whether you've got your crop needle in the right spot, but also you need to know if that head's moving. Your other hand needs to be aware of that so you don't end up injuring the bird. You can restrain large birds in a towel wrap. It can be a bit of an art in itself, but kind of like a birdie burrito, where you lie them in a towel, wrap them up in it, and that helps restrain their wings. You can then tuck them in your arm while you're holding the head, and it just stops them flapping around and moving. The main thing when you do it is to make sure it's not too tight, because you don't want to affect their breathing in any way. Otherwise though, the neck needs to be extended to straighten out that S-bend we talked about earlier, and the head needs to be controlled. So in a little bird, that's one of the best ways to hold. Some people actually hold them like this as well, with the head here. I prefer that way, but it's completely optional. Handling your bird regularly will help you know what works best for you. In a larger bird, you can do something like this where they're wrapped in a towel so that they can't flap around. Now, the crop feeding itself, I have a video after this as well to show you, but the key thing, like I said, proper restraint of the bird. I like to rest my thumb against the neck of the bird, because I always pass the crop needle from my right to left, so on your bird going kind of opposite. But basically, I like to be able to feel the crop needle go down my thumb as I put it in the neck. If you can feel the crop needle through the neck, you're in the right spot, because the trachea, or the windpipe, has complete rings around it that are hard. So if you can feel something pushing against your hand, you're not in that windpipe, because you wouldn't be able to feel it otherwise. Something else you can do, depending on your hand, is if you feel 2 pipes in there while your crop needle's in, you're definitely not in the trachea, because if you're in the trachea, you'll only feel 1 pipe basically, because it feels hard and your crop needle is in there. The other thing is, the bigger the needle, the better, in terms of there's less chance of going down that windpipe if you're using a bigger needle. Obviously though, keeping it appropriate to the size of the bird. Basically though, once you're in the mouth, you just extend on an angle backwards against your thumb. When you feel it touch your thumb, just tilt the crop needle up and go down. And you'll be able to feel when you're in the crop. In most birds, here's on the side of the where you can then inject. Inject slowly though, so if you are in the wrong spot, the beetle probably will find out about it. Otherwise though, the other reason to inject slowly is depending how full the crop is, you can inadvertently fill it too much and then they'll regurgitate. If the bird starts struggling a lot, just abort mission, pull it out gently and put the bird down for 5 minutes and try again. So there's no harm in having 2 goes or anything like that. I guess the other thing to be aware of is the bird will struggle. They will kick their legs in things which you can't often restrain with one hand, but as long as their head is secure and their neck is secure, that's the most important part. And yeah, once the crop needle is in the crop, you can use the medication. So to show you a little video, this is just a little slide that helps demonstrate. As you can see, that thumb is resting against the bird's neck. So when that crop needle ends here, you'll be able to feel it slide down your thumb. And that's the